Hi there. Welcome back to my channel. I'm Ellie. Today I'm going to talk about the different types of pain medication that I have been on since, for the most part, since about 2016. That was the last major exacerbation that I had of endometriosis. And I needed to have another surgery, which would be what they consider the final surgery, which is the removal of one ovary and fallopian tube and my uterus. And that then the surgeon had to do a lot of removal of old scarring. So it was a very painful and long recovery process for me. Now, going into surgery, as my conditions started to get worse, the pain medication I used was Percocet. And up till the day that I had surgery, in order to just get through my days and being able to tolerate the pain, I was taking between 8 and 10 of them each day. I had a hard time sleeping at night. Really, it's not good for your brain and for all your cognitive processes to work the way they're supposed to when you're not feeling very well and you're in unrelenting pain that's just not managed. So I had my surgery done in 2016, and after the post-op course and I was released from hospital, I switched from Percocet to Dilaudid, and I would take that anytime during the day during my recovery period so that I could go to, once the 6 months was over and I was able to then start trying to rehab, I needed to go to physiotherapy, so I did that 2 to 3 times a week. I also went to an osteopath and I saw her 2 to 3 times a week. Now, by that time, my quads had atrophied so much that I was just in constant pain. I added in a massage therapist too to see if maybe she could work on my legs and see if he could get some of the atrophied muscle back into a supple state where it contracted and released. And right now they're in just a what would be like a contracted state. I have very little of my quads around like the perimeter where they're soft, but other times they all spasm up. So that's the time that I started taking Flexeril, which is a muscle relaxant, and I still take that to this day. I've tried to wean myself off it 3 times, but my muscles then just spasmed up and the pain was just too much, so I had to go back on them. So from the time that I had my last surgery for the endometriosis, I just didn't recover. Couldn't get my pain under control. I had to alter my days at work, and then was able to find a pain clinic in one of the hospitals that did injections into, like say if you had back pain, the anesthesiologist that ran the clinic would put in, do injections into your back. For me, it was into both hips. So I was going once every 4 weeks, and I was getting a combination of bupivacaine, which is kind of like a lidocaine that they give in the needle, and it was mixed in with a steroid. The purpose of those two drugs together were that the lidocaine or the bupivacaine would help numb the nerves, and then the steroid would also help calm down the nerves. That I started doing that in 2017, I believe, and seemed to be doing okay. I didn't expect to get totally better, but at least it was a little bit more manageable. And then, of course, the pandemic hit, in 2020. So when everything was being shut down, all the pain clinics shut down as well. So it shut down for probably, I think, 8 months, opened up for a short period of time, and then closed down again. And then by this time, or that time, the injections just weren't doing anything for me really anymore. Went back to my primary doctor and said that is there anything else that they could recommend? I was getting to the point where the pain was so significant and so unbearable that I considered whether or not I wanted to live anymore, or whether I wanted to use MAID, which is medical assistance in dying. When you are suffering from unrelenting pain, where there is nothing medication wise that you can take that will even take the edge off it. The Dilaudid wasn't doing it anymore. I was feeling sick all the time. And as the pandemic wore on, and it was just too much for me and my body, and I ended up going on long-term disability, which was a very hard decision to make, but I was kind of forced into it with the fact that I could not do a full-time job during that time, because it exacerbated all the pain that I had. And of course, I couldn't take pain meds during the day when I was working, and I couldn't wait for the end of the day just so I could get some relief. So once I went on long-term disability, I started looking about what other alternatives were out there that could possibly help manage the pain. And one day I was talking with my family doctor, and she said that she knew a anesthesiologist that was opening up a new clinic in the area where I live. So this clinic was going to be about intravenous medications. I didn't know what at the time, only that they had started using a cocktail of medications given through an intravenous, and they were finding that people were getting long-lasting results from that, and that they could then start to decrease the opioids that they were taking. So I started that, like I said, about 3 years ago. So I go every 4 weeks, and the concoction that I get is ketamine, midazolam, and Zofran. So the midazolam is a benzodiazepine, and it helps to counteract all the hallucinations that you get with ketamine. And of course, things like that always make me feel nauseous. So I get the Zofran, or ondansetron, which is an antiemetic or anti-vomiting type drug like Gravol, but a lot stronger. It's something that the medication is that people who take chemo also use that drug because it works really well. So for the last 3 years, this has been what my life is like. I go to the clinic, I get my IV, I feel not too bad then, probably for 3.5 weeks, and then I have 3 or 4 days where it's all mostly worn off, and then I go back into that pain cycle where then it's like, I can't wait now to just get back to the clinic to get another dose so that I could even just get out of bed and do something. I had my last one done on Tuesday, and it's Thursday today, and last weekend was pretty horrible, waiting to go to the clinic to get my IV medication done, and then I had it done, and once the IV was out and I was up walking around, the pain was zero. There is still some possibility of like a temporary rebound of pain, and I do get that sometimes, but yesterday I had a good day. I went out, drove, was able to go down the Niagara Parkway, which follows the Niagara River as it goes into Niagara Falls. It's a beautiful drive. And if you love the water, being down there, either on the shores of Lake Erie or following the Niagara River, is it's just a beautiful sight. So it does bring you joy and helps you kind of relax and, just enjoy the nature that's around you. So for now, this is what my life is going to be like. It's going to get pain medications every 4 weeks. And then as that's done, then I'm trying to get my mobility back in shape so that I can walk for longer periods of time. For right now, I can't really walk more than 10-15 minutes, and then I have to rest. I also, of course, got diagnosed with Hashimoto's in March of 2021. And along with the permanent nerve damage that I already had in my legs, Hashimoto's caused hypothyroidism because you manufacture antibodies that then attack the thyroid and slowly destroy it. And then it doesn't release the hormones that you need in your body that help you make energy. It also can cause a lot of interstitial edema where you have leakage of fluid into, the free space in your arms, your body, wherever it happens to be. It can get quite edematous and puffy. And so when you're trying to move and use your arms, like just bending it because of the swelling that you get in there, you find that you're actually squeezing it and then increasing the pressure within that limb, which causes quite significant pain. So for right now, that is the current pain medications that I'm taking. I still have Dilaudid for breakthrough. I take the Flexeril, like I said, for my muscle spasms. And then I'm also taking my thyroid pills. And with Hashimoto's, one of the things that helps to try and keep your antibodies down are specific supplements. And then also, for me, which has worked really well, is an anti-inflammatory diet where you remove any sugars and you don't have grains if your body can't tolerate it, and mine can't. So I haven't had any wheat in 3 years, except for there has been a couple times where I have cheated, fallen off the wagon, and had some wheat. And within 8 to 12 hours of consuming it, the pain would just be unbearable. So I've only done it once, and that was enough to tell me that I don't want to go back to that. So I need to just really get up and move. I am going to be 60 years old in several months, and I don't want to live that, the last part of my retirement in a state where I can't go out and do anything because of this. So that's when I also still utilize the CBT, and ACT therapies that I learned from a psychologist that I saw for a year once I was diagnosed, and I was feeling the loss of everything, the loss of my job, the loss of my independence. I needed to go see a psychiatrist or psychologist, sorry, and go over everything and try and figure out, how do I continue to move if everything is causing me so much pain? So the cognitive behavior therapy is kind of a way where you convince yourself that the pain that you're experiencing is not pain. It's just the way your body feels, and that's what you have to deal with. And then you trick yourself, really, into thinking that you're not in pain, it's just heat, whatever it is, that you can push the sense and the feeling of pain to the back of your mind so that you can do something. Because if you're going to be in that amount of pain, but you may be able to bring it down enough with pain medication, you still might be in a certain level of pain. But if you don't go out and do anything, then you start to get depressed. I mean, you're depressed enough when you've got these diseases, and it alters your ability to enjoy your life. So I do that, cognitive behavior, and the ACT, acceptance therapy. So you accept the fact that you're going to be in pain, and that for the most part, that's probably going to be a permanent part of your life. But you are then committing for yourself to, no matter how permanent the pain is, that you still need to be able to get out and enjoy life. It's, like I said, it's not an easy concept, either of them, but you get to the point where you either have to start doing things to enjoy your life, whatever those things are. And I think that we can talk about that as, I start to do more videos and just ways that you can make yourself feel happy each day. Even if you're doing something and it only lasts for an hour, hour and a half, and then you're back at home resting. Because I did that today. I went out for breakfast with my best friend and her daughter. We had a really nice time. I was only gone for an hour and a half, but I was in some significant pain because not only do I have my quads that are also atrophied, but I get spasms in both of my hamstrings too. So it makes sitting in a car or sitting anywhere for any length of time quite difficult. That's why I've got my Rojo cushion and some other offloading cushions that I take with me to just try and give myself a little bit of relief from sitting for any length of time. So I'd made myself just some notes just to make sure that I covered what I wanted to today when I'm talking about pain medication. I know that there's probably a lot of places where this might not be something that's available to you. So in Ontario, we have right now maybe two, three in the Western Ontario that are open, but they've got wait lists of sometimes up to 2 years. So for anybody who is watching this that happens to live in Ontario and you're also living with chronic pain, one of the things you need to be aware of is that there's been some changes in OHIP and what's been covered. So some of the services were delisted. So I am in the process of complaining to our MPP and getting that brought forward to the health critic of the NDP to take to the floor of our ministers of parliament. So that's provincial parliament, kind of like congressman maybe in the US. I'm not really exactly sure what the equal job would be there. So once I learned that these things were going to be taken, like you're going to have to start paying out of pocket. I know that there was quite a few people that went to the clinic and they said that there's just no way that they could do that. And it's so unfortunate because everybody starts talking about opioids and the epidemic of overdoses and all that. And you get a clinic that can help people with pain and reduce their reliance on opioids. And then all of a sudden it's like, we're not going to cover it anymore with your Ontario hospital insurance plan. And that's not right. In Canada, we have universal health care, and the government, the federal government, does transfer payments to the provinces to deliver that care. And if they're not doing it, then the federal government will need to get into this discussion about why things in certain provinces are getting taken off their provincial insurance plan. So I'm in the process of working on that. I am want to be, aside from somebody who's suffering in pain, somebody who's an advocate for others. So if you're going through something and you have no idea what to do, what's causing it, maybe you've been to the doctors and you're not getting anywhere, talking to other people, you might come across somebody who actually does have the same symptoms as you, and maybe they were diagnosed and they were able to then start planning their health interventions. So I've seen quite a few people on YouTube that have autoimmune diseases, and on one, State of Kate, which I love to watch, it was her audience that actually said to her, I think that you might have POTS and this other disorder, Ehlers-Danlos syndrome, I think it's called. And it was her subscribers who actually said, "Here's, I think this is what you've got because this is what I've got." And then she was finally able to get a diagnosis, and she'd been struggling with it for years and years. So we are a wealth of knowledge. We just don't really know that until you might come across somebody who says, "Hey, I feel awful and I don't know why, and I've been to the doctors. Nobody seems to know, and I'm not getting any help." So being in a community where you can talk about pain, talk about management of it, is good, but you really want to get to the root cause of it and see if there's anything that you can do that will decrease the amount of pain that you're suffering and help you lead a more enjoyable life. So that's all I've got for you for today. I just wanted to tell you about the type of medications that I started with and how I got to now having IV ketamine every 4 weeks. And if you have any questions about that, what it's like to actually have that medication, because it's quite something when you are having ketamine. It's not just like a usual drug that you just get, a little bit of it and then you're fine. It is, mine that I have is an hour long. You can have them longer too, but it is a very strange feeling when you're having ketamine. So anyway, I think that's about it for today. I did not sleep well last night. I was probably up until 1:30, and then I had to get up at 7 to get my blood work done for checkup on my Hashimoto's. I would guess that the way I've been feeling, because no matter how well my leg pain is controlled, I still have the issues of Hashimoto's and osteoarthritis, where I've got, pain in different joints from the osteoarthritis, and then swelling in my neck from Hashimoto's. And if my TSH is really high, then I'm going to need an increase in my thyroid medication as well. So there's lots of moving pieces when you're building a picture of a patient. It's not one thing that you fix and then miraculously everything else is okay. When you have chronic diseases, it can take a very skilled practitioner to be able to help you manage it. But you also need to get involved yourself. Learn what it is that you have, and then only you can decide if doing things like the autoimmune protocol diet is something that you want to do. For me, it helped a lot. I really discovered what sugar was doing to my body when I went off it and then kind of, you know, slipped and started eating chocolate and ice cream and all that kind of stuff because I was feeling sorry for myself. But now that I've been off chocolate and sugar and all that for the last 3 weeks, and I had my pain medication a couple days ago, I'm feeling a lot better. Until next time, and my next video, I'm Ellie. Have a great day, and I'll see you soon.